This is the electroconvulsive therapy. So what is the definition? Definition is the formally known as electroshock is a psychiatric treatment in which seizures are electrically induced in anesthetized patient for therapeutic effect. What are the indication? The indication for ECT are major severe depression, severe catatonia, severe psychosis, schizophrenia, mania. Mechanism of action. The exact mechanism of action of ECT remains elusive. One hypothesis states that ECT possibly affect the catecholamine pathway between the diencephalon and limbic system, also involve hypothalamus. The technique used for ECT administration are two types: direct ECT and modified ECT. Direct ECT will nowadays stopped, and modified ECT will be used. Electrodes, according to the placement of electrode, ECT is two types: unilateral and bilateral. Bilateral, you can see on the diagram, this is the bilateral and this is the unilateral. We can place the electrode in this side. Nursing care in ECT, providing educational and emotional support whenever we giving ECT procedure, pre-treatment planning and assessment, preparing the monitoring the patient during the actual procedure, post-treatment care and evaluation. Providing educational and emotional support, explain the procedure to the patient, informed consent, respond to the patient concern and feeling, educate the patient concerning the procedure, initiate education intervention based on knowledge deficit. Whatever we have planned to give the patient for the ECT, we have to explain to them that what is the procedure and how we will do the procedure on them. So this is the topic of ECT. My reference book name: PV R. Sri Srivani, S. K. Maheshwari and Radhima. Thank you.